consciously or unconsciously, health is a constant factor in our lives. How do we stay healthy? And what kind of medicines can we use once we get sick? Today I'm visiting a faculty who focuses on all these questions, because today I am at
the Leiden University Medical Center. My name is Britta and I'm a biomedical sciences student.
Hey Britta, we're not at the entrance of the building, right?
No, that's right. That's actually because the faculty has several buildings, which is why I wanted to give you a bike tour first.
Sounds good.
Yeah, shall we go? So we're really close to the central station now, which is just behind us. And on the other side, that's the city centre. But on this side, we have the historical Poortgebouw. And that's where the former Leiden Hospital was. But now we have the Leiden University Medical Center on that side. And theory and practice literally come together for students there.
Nice. And I heard that this is also part of the Leiden Bioscience Park?
Yes. That's actually the largest bioscience park in Europe. It has over 100 companies and facilities.
Wow.
And we also work together with them. So from this angle, you can see the research building over here. And we have the education building over there. And then there's the main building of the Leiden University Medical Center over there. And it's actually connected to the research and education buildings by these bridges you see there. Are you ready to take a look inside?
Yes.
Okay, let's go. So this is the entrance to our education building, the foyer, and we also hold poster presentations here and receptions for symposia. Over there is student services and we have study spaces, but above us is this huge golden egg, which is our largest lecture room, but I'll take you there later. First, I want to show you our most unique facility, the dissection room.
The dissection room, that sounds quite exciting.
It is.
As long as I won't be the test subject.
No worries, no worries.
All right.
So before we enter the dissection room, we first have to wash our hands. And then after this, I'll get you new gloves and a face mask and a cap. But most importantly, I'll get you a new suit. How does that sound? So, here you go.
Oh, this does feel like the real work.
It is the real work. So, I'll see you after you've changed, okay?
Sure.
Okay, see you in a bit.
Wow, what a space.
Yes, you can get a lot out of books, but certainly not everything. So here we work with real human materials.
Oh, so clearly not the place for jokes then, right?
No, we have to treat everything we do here and the materials we work with the greatest amount of respect. Also, for example, this real human heart.
Oh, that's amazing.
Isn't it? So the human anatomy comes back on every level, from student to doctor to researcher.
So this isn't just a place for future surgeons then?
No, there's also medical students and biomedical students and also surgeons doing research.
All right. And what do we see on the tables here?
Well, here you can see a demonstration practitioner for clinical technologists and scrub nurses. And shall I show you the other tables?
Yes.
So this is a practical where doctors and surgeons can practice working with using an X-ray. You can also see the lead shields to protect everyone around. And this third table, here you can see a practical for first year medicine students. So you can see brains here and also brain slices.
That's so impressive.
Isn't it? So, shall we continue?
Yeah, let's go.
Because this is also a lab, we have to wear protective clothing. And we also work with hazardous chemicals, and for that we can, for example, use this fume hood, and then we can work with everything well, it protects us, but it can also protect the materials that we work with from us. For example, when we're working with living cells. And here you can see some practical setups that we can work with.
Well, but this is all very impressive, but are they also normal lecture halls?
Of course. For example, the golden egg that we saw earlier, that's our biggest lecture hall. Shall I show you?
Yes, please. And then I can take off this coat, right?
No, you have to also wear that inside the lecture halls.
For real?
No, of course not. Just kidding.
Right, let's go then.
Let's go. We can go this way now.
Oh, all right.
So earlier in the foyer, we were beneath this golden egg, but now you can see the inside of this big lecture hall.
Wow, this can really hold a lot of students.
Yes, 400 people. And it also hosts student introduction events, international conferences and symposia, and graduation ceremonies. Now, have you noticed anything particular about these doors?
These doors?
Yes.
Well, they're black, but that's it.
Well, that's true, but they're wide enough to allow patient beds to roll in.
Patients in here?
Yes, right from the main building. Patients come here and students can ask them questions and learn from them.
Wow, that's very impressive and special indeed.
It truly is. In fact, everything comes together here, because in the previous rooms I showed you where the research is done, where we investigate how disease affects the human body. And then the doctors make up a treatment plan, and then medicinal drugs are eventually needed. And that's where the pharmacists come in play. They determine which ones to use, which doses, and which combinations can or cannot be used.
And it also differs per person, right?
Yes. For example, aging, which is one of our main research topics, because people are living much longer than previous generations, we are usually dealing with several ailments at the same time, and then you have to look extra closely at what can and cannot be used.
And what exactly does the machine behind you do?
Well, this is actually a robot. I'll show you.
A robot?
So there's a lot of medicinal drugs here, and the robot can easily find them and then get them for us, which saves a lot of time, and that time we can then use for our patients.
Ideal. I would like to have this robot at home to get myself a drink.
Well, speaking of drinks, shall we go to the faculty bar?
Sounds great.
Let's go then.
Ah, the best place to end today.
Certainly. But this place is also very special because not only do our students come here, but also teachers who are often doctors or researchers. And during teacher-student drinks, we can chat about education. And this informal environment is very important because then we can stay in touch with our teachers. And we also award the best ones with prizes during the annual education awards.
Well, as far as I'm concerned, everybody that works in healthcare deserves a prize.
Very true.
Thank you for the tour.
Anytime.
I hope you liked the tour. And we will see you as a student in the dissection room or here in the Hepato bar. Till next time.
Would you like a drink?
Definitely.
Well, let's get one then.
So how long was your study then?
3 years.
3 years.